Following representations from the Liaison Committee, I can notify the House today that I am extending the order until Thursday the 17th of September. We now come to the urgent question. I call Jonathan Ashworth to ask his urgent question.
To ask the Secretary of State to make a statement on the R value and lockdown.
I now call the Secretary of State, Matt Hancock, for 3 minutes. Matt Hancock.
Thank you very much, Mr. Speaker, for this opportunity to update the House on progress on our plans for controlling coronavirus. Thanks to the immense national effort on social distancing, as a country we've made real progress in reducing the number of new infections. And as we move out of lockdown, we look at all indicators to assess progress in tackling the virus. Last week's ONS infection survey estimated that the number of people who have had coronavirus in England fell from 139,000 between the 3rd and 16th of May to 53,000 between the 17th and 30th of May, a drop of over half. In terms of new cases, an ONS estimate released on Friday shows that there are now around 5,600 new cases each day within the community in England, a huge drop since the peak. The number of new fatalities each day is thankfully falling too. Today's figure records 55 fatalities, the lowest number since the 21st of March, before lockdown began. They also show that there were no deaths recorded in London hospitals, which is a real milestone for the capital, which of course, in the early stages of this pandemic, faced the biggest peak. And yesterday we saw no recorded deaths in Scotland, which is very positive news for us all. Sadly, we do expect more fatalities in the future though, not least because the figures recorded at the weekend are typically lower. And what's more, Mr. Speaker, 55 deaths is still 55 too many, and hundreds of people are still fighting for their lives, and each death brings just as much sadness as when the figure was much higher in the peak. And I know that the thoughts of the whole House are with those families and communities who are grieving their loved ones. We of course also look at the R rate. SAGE confirmed on Friday that their estimate, taking into account 10 different models, is that R remains between 0.7 to 0.9, and that it is below 1 in every region of the country. This means that the number of new infections is expected to continue to fall. So there are encouraging trends on all of these critical measures. Mr. Speaker, coronavirus is in retreat across the land. Our plan is working, and these downward trends mean we can proceed with our plans, but we do so putting caution and safety first. Even at the peak of this pandemic, we protected the NHS and ensured it was not overwhelmed, and we will not allow a second peak that overwhelms the NHS. We're bearing down on the virus in our communities, aided by our new NHS test and trace system, which is growing every day. We're bearing down on infections in our hospitals, including the new measures to tackle nosocomial infection, like face masks for visitors, patients and staff. And finally, we're strengthening protections for our care homes, including getting tests to all elderly care home residents and staff. And I'm glad to be able to tell the House, Mr. Speaker, that David Pearson, the eminent social care expert who's previously led the social care body ADAS and who has decades of experience of leadership in both social care and public health, will be chairing our new social care task force to drive our COVID action plan yet further. David has an impressive track record, and I'm delighted that he'll be supporting us in leading this important work. Mr. Speaker, together we are getting this virus under control, and now more than ever, we must not lose our resolve.
Shadow Secretary of State Jonathan Ashworth with 2 minutes.
What's just been said about the Social Care Task Force, may I say, it probably should have been set up some months ago, Mr. Speaker. Now, the government is easing restrictions, but even looking at their own tests, we know that PPE supplies are still not secured. We have dentists warning about PPE today. Tracing is still not fully operational. The Chief Operating Officer of Test and Trace warned it will not be fully operational until September. Testing is still not sufficient. We are still not routinely testing all NHS staff, whether asymptomatic or not, even though we know that will arrest the spread of the virus in hospitals. And the R value, according to the PHE Cambridge model, is close to 1 in many regions and is at or above 1 in the northwest and the southwest. And the modellers of that, from that model warn that this may result in the, quote, the decline in the national death rate being arrested by mid-June. Now, the British people have shown great resilience and fortitude in observing this lockdown and helping slow the spread of this deadly, horrific virus. But we have still had over 40,000 deaths. As the Secretary of State said, infections are still running at over 5,000 a day. We should proceed with caution, but many now fear that the Prime Minister is starting to throw caution to the wind. So can I put to him some specific requests? Will he agree to start publishing on a weekly basis the regional R value estimate alongside the national estimates? Does he agree that the voices of regions must be heard in future decisions about lockdown? And will he start including the various metro mayors, such as Andy Burnham and so on, in the COBRA meetings? Will he ensure this week that local authorities and GPs start receiving specific data about who has been tested positive so they can start putting in place area-based response? Will he issue this week on defining what a local lockdown is, how it will be enforced, and what resources and powers local authorities and agencies will be able to draw upon? And finally, Mr. Speaker, we know that the more deprived an area is, there is a higher COVID mortality. There are pockets of deep deprivation in the northwest and in the southwest, parts of Cornwall, for example. What support will be given to those who are asked to isolate, financial support? And given we also know that BAME people are more at risk from COVID as well, will he now publish the Public Health England report into disparities in full, all the chapters, all the analysis, all the recommendations, because action to protect BAME people, especially BAME health and care staff, must be an urgent priority.
Secretary of State.
Well, thank you very much, Mr. Speaker. Just a couple of points in response. The first is that on PPE, we have turned around an incredibly difficult situation when demand for PPE shot up. And thanks to the incredible work of Lord Dighton, we now have good PPE supplies to all sectors, and we're working with the dentists to ensure that they too will be able to get the PPE that they need. He talks about testing, but he omitted to mention that we have hit every goal when it comes to our testing expansion, and we have now a capacity of more than 200,000 tests a day. And last week we were achieving that level of testing, which is itself a testament to the work of so many people in companies and in the public sector who've done just an incredible piece of work on testing. He picked on the results of one particular model that we look at, but he surely understands that actually the way that you get the best advice is looking at all different models rather than just one. I mentioned one other survey, which is actually based on data rather than modelling, the ONS survey. And I also told him already the SAGE view, taking into account all of the evidence, which is that R is below 1 in each region. As he said, we do publish R. He's quite right about the importance of working with local authorities and local leaders. I spoke to the Mayor of Greater Manchester on Friday about the higher rate of R, albeit assessed to be below 1, the higher rate of R in the northwest, and local leaders are incredibly important in terms of the local action that we'll be taking. He asked about local authorities and GPs getting access to data. We are working with them on the appropriate data that should flow to local authorities and GPs. He asked, quite rightly, for guidance on how local action will work, and that is an important early piece of work for the JBC, the Joint Biosecurity Centre. I'm glad that he's recognised the importance of the work that Public Health England has done and published on the disparities between people of different ethnic backgrounds and also other differences. For instance, the fact that older people are much more likely to die from COVID-19. It's very important that we base our response on all of this evidence.
Can I select Committee Chair Jeremy Hunt?
Thank you, Mr.
It's
Speaker.
21
the Prime
hours.
Minister's testing turnaround target does not apply to postal tests, given that the majority of infections can happen less than a week after the person who gives you the virus develops symptoms, will he consider replacing postal testing with same-day delivery and collection of testing? If it's good enough for Amazon Prime, it should be good enough for NHS Test and Trace.
Thank you, Mr. Speaker. He's quite right to raise this because the testing turnaround speeds are very important and they're improving. The answer is that we are intending increasingly to use the turnaround routes that have a 24-hour turnaround for the symptomatic testing that therefore needs this rapid response, and use the routes that have a slower turnaround for asymptomatic testing where the timing of the test is less important. That's the direction of travel, and we intend to solve the problem that he rightly highlights in that way.
We now head north of the border to Dr. Philippa Whitford, who is the SNP spokesperson, with 1 minute. Dr. Whitford.
Thank you very much, Mr. Speaker. The R number is close to 1 across England and may even be above that in some areas. As the R number reflects lockdown changes made a couple of weeks ago, does the Secretary of State not accept the need to assess the impact of sending people back to work and school before making further changes to lockdown? With Serco admitting their tracing system won't be fully operational until September, would he not have been better investing in public health systems instead of a private company with no expertise? Why are the test results from the commercial labs still not being sent to local GPs and public health teams to allow And finally, we all recognise the economic impact of lockdown. But does he not accept the worst thing for the economy would be a second wave needing a second lockdown?
Thank you very much, Mr. Speaker. Well, as a clinician, I think the Honourable Lady will recognise that taking into account all of the evidence of the rate of transmission is incredibly important. And I think that it is an error and it's wrong and it's beneath the normal standards of her questioning to focus just on one report rather than on all of the reports. And I hope that when she speaks to people in Scotland and across the whole country, that she will take into account all of the evidence rather than just focus on one report. And I just urge her to do that because that is important for the public communications. The other point I'd make is that the NHS Test and Trace programme is being built at incredible pace. As the Prime Minister said, he committed that we would get it up and running for the 1st of June, and we've delivered that, and that it will be world-class, and we will deliver that. But we couldn't deliver it without public and private sectors working together. And I think the divisiveness that just comes through from the other side is a real mistake in these difficult times. Instead, everybody should be working together.
Thank you, Mr. Speaker. Parents in my Warrington South constituency have been in touch overnight to say how disappointed they were by a decision taken by local councillors yesterday afternoon not to open primary schools today. Does the Secretary of State agree with me that local authorities need to look at a number of local factors, not just regional R data, for a wider area when taking important decisions on getting our children back to school?
Well, I do, absolutely, and it is particularly a mistake to look at just one model rather than the overall assessment of R in each part of the country, which is assessed to be below 1 in each area, and therefore, with the number of new infections coming down, we can take the plan forward, and we ought to take the plan forward, because the education of children matters, as well as, of course, controlling the virus.
Thank you, Mr. Speaker. The government have repeatedly said that lockdown will only be eased when the R rate is below 1 and the threat level is coming down. Now, the threat level is still at 4, and as the Right Honourable Gentleman has said, in the North West there are some calculations of the R rate that have it above 1. Many of my constituents are really worried about this, yet the government's accelerating plans to end the lockdown more quickly than it announced that it would. Why?
Thank you very much. We are continuing with the plan that we have, which is cautious, and takes a safety-first approach, and based on all of the information, not just, as she quite rightly pointed out, just one part of the information, we said that we would take the next steps when the 5 tests have been met. They have been met. R is below 1, and the other 4 tests have also been met, and that's why we're able to proceed. And the evidence that we're increasingly seeing of the number of new cases coming down, and thankfully the number of fatalities coming down, these are good news that demonstrate that the plan is working.
Harriet Baldwin.
Thank you, Mr. Speaker, and we're also grateful to our NHS and care workers. And so many people have made so many difficult sacrifices during this period of lockdown. They are furious to see the lack of social distancing in some of the protests that took place over the weekend, and they want to know what impact that might have had on the reproduction rate of the virus.
Secretary of State.
Well, I thank my honourable friend, right honourable friend, for this question. It is incredibly important that people follow the social distancing rules, and the demonstrations that we saw over the weekend, where they did not follow the social distancing rules, risk increasing the spread of the virus. That is the clear scientific evidence, and it is a mistake, Mr. Speaker, for people to participate in demonstrations that help to spread this vile disease. Instead, we should all be acting to do our bit to reduce that spread.
We're going up to the northwest with Barbara Keeley.
Mr. Speaker, with the R number above 1 in the northwest in one model, we need action to prevent a second wave of infections and deaths. Now, the Secretary of State has talked about local lockdowns, but can he commit to Public Health England supplying more local information on the spread of the virus to assist that? And can he also tell us whether there'll be additional powers and financial support for areas covered by a local lockdown, as called for yesterday by our Greater Manchester Mayor, Andy Burnham?
Yes, we hope very much to be able to publish more and more granular, localised information and work with local leaders in order to deliver on what's needed to act upon it.
Sir John Redwood.
Given his great success in expanding the number of tests, will we soon have more precise and accurate R figures along with the other information now accumulated? And is there a danger in interpreting back trends that they are unreliable because differential test rates?
The answer is yes and yes. It's the survey testing that is the most reliable way of assessing the prevalence of the disease and its downward trajectory, and that's because that takes into account a randomised approach to working out where the disease is, much like an opinion poll that we are familiar with in this House. Because as the amount of testing has gone up, so inevitably more cases have been found. And that's a good thing, of course, that more cases have been found, but we need to know the prevalence, which is best done by surveys.
Right north of the border with Kirsty Oswald. Kirsty.
Thank you, Mr. Speaker. The Secretary of State has just spoken about the importance of people following the rules. It's clear that Dominic Cummings' rule-breaking trip across England has undermined the little confidence there was in the UK government's public health messaging. Does the Secretary of State appreciate the harm that's been done by the outrageous spin and shape-shifting on this? And what's he going to do to repair the damage?
No, I don't think that's got anything to do with it. I think actually the most important thing is that people follow the social distancing rules, and I think that should apply even if they have a strong and heartfelt case to make in a public discussion such as at the weekend.
Stephen Crabb.
Thank you, Mr. Speaker. The success of the government's strategy rests to an enormous extent on public support and consent for the lockdown measures. So can I ask my right honourable friend, what advice is he receiving from his behavioural experts on the viability, the sustainability of localised lockdowns? It's a challenging thing to set the country on a path to easing restrictions and then to want to dial it back again.
Well, of course, it's important to ensure people are fully informed of the reasons why we may need to take action in a particular local area, and that's a very important part of the consideration. And making sure that local bodies, for instance local directors of public health, are fully engaged is is an important way of doing that. And of course, in the case of Wales, where my right honourable friend represents, that this is done through the devolved nations with their responsibilities locally for public health.
Mr. Speaker, while the R number is one indicator of infection, it's only reliable at regional level. Currently, directors of public health tell me that they are only receiving high-level reports when what they actually need is more localised information, with data relating to the number and location of cases and when infection occurred. This information is vital to stopping transmission, especially as restrictions are lifted. Can the Secretary of State tell me by which date this information will be available to local authorities in order to inform their local outbreak plans?
As soon as practical.
We now come to Jack Brereton.
Thank you, Mr. Speaker. Many of my constituents in Stoke-on-Trent South are now sending their children back to school or will soon be going back to work in places like retail. They want confidence they are doing so doing the right thing for their families. Could my right honourable friend assure me that my constituents that each step that the government is taking is based on the advice and science?
Absolutely, Mr. Speaker. Throughout this, we've based our decisions on the science and the scientific advice, of course taking into account all considerations, but the scientific advice, for instance from SAGE, is so important, and it is absolutely critical that we could take into account all of the science, and that's why I think that it's a mistake for people to pick on one particular report and focus on that, as opposed to looking at all of the science in the round.
Ruth Capley. Thank you, Mr. Speaker. People living in residential care support for learning and other disabilities are at high risk of catching COVID. But it's good to know that in Hounslow, those living in residential care have not yet contracted COVID. But unlike settings for older people, they cannot access testing kits. So when will the government ensure that all residential care settings, including those for under 65-year-olds, be able to access testing?
Mr. Speaker, the Honourable Lady is quite right to ask this question. It's on clinical advice, in fact the scientific advice that we were just discussing, that we took the whole home testing for residents and staff to older care homes for older people first, because you are 70 times more likely to die from COVID-19 if you're older than younger, and a significant age gradient. However, now that we have got tests to all of the eligible elderly care homes, we are now moving to delivering the same for people of working age.
Red Clark.
Thank you, Mr. Speaker. On that very point, the Secretary of State is quite right that it's important to protect our older citizens, and it is true that they are able to get tests for older people themselves and for workers in care homes. But that is not the case for people who live or work in retirement villages and supported accommodation. Will the Secretary of State intervene to correct that anomaly immediately so that we can protect all of our older and vulnerable people?
Yes, of course, that's taken into account in the clinical decision over the order of priority for testing, and my right honourable friend makes a very important point that I will ensure is taken away and looked at, and to check that we have people in those settings outside of formal social care, often not CQC registered, but still with a much higher proportion of vulnerable and elderly people who are vulnerable to this disease in them. And I'll make sure that that's properly looked into. And if I may, Mr. Speaker, I will write to the chair of the Science Select Committee on this precise point.
Kevin Brennan.
Thank you, Mr. Speaker. The Secretary of State says they're taking a safety-first approach in government. And yet, Professor John Edmonds has expressed concern that if we relax, the infection will come back very fast. In Wales, there's been a more cautious approach to allowing people, or suggesting that people should be able to travel such long distances, as we saw the weekend before last in Dorset. I mean, what's he going to do if the R number does drift back above 1?
Well, I don't want to see the R number go above 1. I spoke to Professor Edmonds at the weekend, as it happens, and if he, like I, saw what the professor had to say at the weekend, he said that, quite rightly, a cautious approach is what's needed, but there is scope to be able to allow some opening up according to the plan that we've got.
Mark Pritchard. Thank you, Mr. Speaker. Of course, the international R rate matters too, and I welcome the Prime Minister hosting the Global Vaccine Summit in the UK last week, which raised an astonishing $88 billion. But given the UK is the largest contributor to the Gavi Vaccine Alliance, can I ask the Secretary of State what support this government is doing for low-income and developing countries, particularly in the Commonwealth and overseas territories?
This is an incredibly important point, Mr. Speaker, because being able to get a vaccine everywhere around the world is incredibly important to us here at home. Of course, our top priority is access to the vaccine for the citizens of this country, but we're also using our aid budget in order to ensure that should a vaccine work and become available, we can not only deliver it here, but be good global citizens and put, as he says, we put more into this than any other country on this planet.
Laura Wilson.
Thank you, Mr. Speaker. Professor Edmonds also said yesterday that the R value was largely being driven by outbreaks in care homes and hospitals. Despite his statement today, we know that there are still some care homes, including in my own constituency, where residents and staff have yet to be tested. How can we effectively bring down the R rate without regular testing? And will he commit to regular testing in all care settings, including the under 65s and those with learning disabilities?
Well, she's absolutely right that testing in care homes is important. I'm very pleased that we hit the target. My team hit their target of ensuring that all care homes have access to tests by Saturday, which was the target that we set for elderly care homes. That's almost 9,000 care homes got kits for all of their staff and residents to be tested. And the important thing is that did not show a huge amount of infections that we didn't previously otherwise know about. And I'm absolutely delighted that David Pearson, who it's worth the Shadow Secretary of State acknowledging, has been working with us throughout this whole period. David Pearson will now be taking a leadership role in driving forward this work to protect our care homes yet further.
A bit more.
Thank you, Mr. Speaker. Quite rightly, many of my constituents have contacted me regarding concerns of mass gatherings and lack of social distancing, which we unfortunately witnessed in Ilkley last weekend when many visitors came to enjoy the sunshine. Can my right honourable friend confirm that the R rate is below 1 in West Yorkshire? And will he also consider local lockdown if appropriate, so that if we do see a flare-up in infections in one part of the country, we can take action where necessary?
I want to protect all of the residents of Ilkley from this disease, and as we've got the number of new infections each day right down to between 5,000 and 6,000 according to the ONS each day, a long way below where it was at the peak, and as the number of deaths has fallen, so I want to keep that down, and where there is evidence of a specific cluster or flare-up, we take local action there, and that will help to protect the residents of Ilkley and elsewhere in Yorkshire and across the country, so that we can then safely release other lockdown measures whilst keeping the community safe.
Liz Twist.
Thank you, Mr. Speaker. Following on nicely, what local resources and funding will be put in place for local authorities to deal with local lockdowns where they are needed?
Yes, we've already allocated £300 million to precisely this task. And of course, making sure that local authorities are properly funded for their role, which is a very important role in local action, is an important part of the task.
Anthony Higginbotham.
The Secretary of State will be aware of the media reports saying that the R rate in the North West is above 1, which has understandably caused concern to my constituents in Burma. Could he reassure them and people across the North West that the R rate is below 1 in the North West, but also that we have to look at all of the evidence, and on that evidence we are still defeating this virus?
That's right. I set out some of the evidence in my statement, and Mr. Speaker, it is very important that we look at the overall base of evidence and we take scientific advice on that. There are 10 models that go into SAGE, and it is important that the media reports the facts, which are that if you take into account all of these models, then R is below 1, according to SAGE, in each region of the country. Now, of course, scientific models will come out with different results, and it's quite right that the scientists should publish and discuss those, and that's how science advances. But it's also important that the media play their part responsibly, and I can reassure the residents of Burnley and elsewhere in the North West that our overall assessment is that R is below 1 in the North West and everywhere else in the country. But of course we keep this closely monitored at all times.
We now go north of the border with Neil Gray. Neil Gray.
Thank you, Mr. Speaker. Can the Secretary of State advise